should you consider optimizing your testosterone after menopause? In today's video, I'm going to walk you through 3 reasons you might seriously consider it and 3 reasons that some women choose not to optimize testosterone. This is the 3rd video in a playlist that I've created to help you understand the real why behind hormone optimization during and after menopause. If I could help a woman in menopause understand one word about why she should optimize her testosterone, it would be the word mobility. After menopause, women start losing both muscle and bone pretty fast. That loss leads to weakness, frailty, falls, eventually fractures and walkers and wheelchairs and sometimes assisted living. But it can happen so gradually that women just don't even realize it's happening until it's too late. Optimal hormone levels, especially testosterone, can help you maintain your strength, your balance, and your mobility for decades to come. In fact, testosterone has been shown to increase muscle strength and reduce the risk of frailty and falls in older women. When testosterone is combined with estradiol, it also helps protect bone density, reducing the risk of osteoporosis and fractures in the hip and the wrist and the spine. A broken hip after a fall is one of the most common reasons an older woman can lose her mobility and her independence. The numbers are that up to 30% of cases, complications from a broken hip can actually lead to death within a year. There's no reason that you should lose your mobility and your independence just because you're getting older. Testosterone, along with resistance training, that's weights, and optimal estradiol, can help you stay strong, mobile, and independent for life. The second word I'd want a woman to consider when she's thinking about optimizing her testosterone after menopause is the word cancer. Well, hormones cause breast cancer, don't they? That's a belief that's been drilled into women's minds for over 2 decades by the media, even by a lot of your doctors. But there's really no evidence that testosterone specifically increases breast cancer risk in postmenopausal women. In fact, the exact opposite may be true. There was a large 10-year study by Dr. Rebecca Glazer and her team that found subcutaneous testosterone significantly reduced the incidence of breast cancer in both premenopausal and postmenopausal women. Another study by Agrawal and colleagues showed that women receiving testosterone had about a 48% lower risk of breast cancer than women who didn't take testosterone. A systematic review by Guerra and team concluded that transdermal testosterone does not increase breast cancer incidence and may even offer some protection against breast cancer. Testosterone appears to have anti-proliferative effects. It means it doesn't encourage cells to grow too fast. It suppresses abnormal cell growth and triggers apoptosis or cancer cell death. So instead of increasing your cancer risk, testosterone might actually help lower it. The third word I'd want women to understand when considering testosterone optimization is desire. One of the most devastating symptoms of menopause is the loss of sexual desire. That loss can creep in slowly, sometimes even a few years after you go into menopause, or desire can sort of disappear overnight. It doesn't just affect you, it can also strain your relationship, it can erode intimacy, it can leave you feeling broken, ashamed, alone. Well, I hear from women all the time who want to feel close to their husbands again, but they just don't have that desire anymore. Testosterone's been shown to significantly improve sexual desire, arousal, orgasm, overall satisfaction in women diagnosed with HSDD. That stands for hypoactive sexual desire disorder. Well, realistically, testosterone isn't a miracle hormone that fixes everything about your relationship. You might have disagreements or communication problems or financial, family, work stress, body image issues. Testosterone isn't going to fix any of that, but it can help with increasing your desire, maybe back to a level that you had when you were younger. But when I say desire, I'm not just talking about sexual desire. Testosterone also improves a woman's motivation, her confidence, her overall sense of well-being. It helps restore energy. It sharpens your mental focus. For many women, it helps bring back the spark that they've been missing, not just in the bedroom, but in life in general. A woman's desire to keep going, to really live. Well, I recently heard from several women who've told me that once they started optimizing their testosterone, that's when they really started feeling great. Estradiol and progesterone were helpful and they relieved symptoms, but testosterone really boosted them. It's sort of the hormone that tends to give you a quick win. Now let's talk about 3 reasons that some women might choose not to optimize their testosterone after menopause. The number 1 reason a woman might choose not to optimize her testosterone can be summed up in this word: masculinization. Well, the topic of gender transition is probably the biggest culturally and politically sensitive minefield in today's world. I'm not here to weigh in on that conversation, believe me. But it is important to recognize that high-dose testosterone is at the center of female to male transition processes. So when a woman hears testosterone, it's not unusual for her to say or maybe think, I don't want to become a man. Well, that sounds perfectly reasonable. But here's the truth. The physiologic doses of testosterone that are used in postmenopausal hormone optimization are just a tiny fraction of what's used for gender transition. It is the same hormone, but these low doses are designed to restore testosterone to those optimal female levels, not to male levels. Male levels are 4, 5, 10 times higher. These levels don't cause you to grow a beard, deepen your voice, or become someone you're not. They help restore your energy, your motivation, your mood, sexual function, without turning you into someone that you don't recognize. The number 2 reason women hesitate to use testosterone can be summed up in one word: hair. Well, even though I just said that testosterone isn't going to turn you into a man, there is a small risk that you could experience some mild side effects that are related to the fact that testosterone increases male characteristics. There's sort of a continuum of the effects of testosterone, from too little on one hand to too much on the other. I use that word hair to represent the broader idea of unwanted side effects, especially the ones that feel a little too much toward the masculine side. These side effects might include unwanted hair growth. Sometimes it's in the form of small dark hairs on your upper lip or hair growth in other areas that you weren't expecting. Things like acne can be fairly common. Those are the 2 most commonly reported side effects in clinical trials of testosterone in women. Like all the side effects with testosterone, they're also dose dependent, which means they improve or disappear when the dose is dialed back a little bit. 2 other side effects are only seen when the dose is pushed really high, what we call supraphysiologic doses, and that would be clitoral enlargement and voice deepening. I've talked with women who've had both of these side effects, and reducing the dose definitely helped to clear those up, although sometimes it takes a little bit of time for that testosterone to wash out of their systems. In some cases where a woman is especially sensitive to these side effects, a provider might prescribe something called spironolactone. That's a medication that sort of blocks some of the androgenic or masculine effects, while still allowing you to get the benefits of testosterone. The side effects are manageable, especially with the help of a hormone optimization specialist who understands how to personalize your treatment. The number 3 reason a woman might choose not to optimize her testosterone can be summed up in this word: FDA. I guess that's an acronym. In the United States, there is no FDA-approved testosterone product for women. Testosterone has been approved for use in postmenopausal women in places like Australia and South Africa, but not in the US, Canada, or the UK. That fact alone can be enough to make some women and their doctors a little hesitant. But just because a hormone is used off-label doesn't mean it's dangerous. In fact, testosterone has been prescribed off-label to women in the US since the 1940s. Several large studies, including that 10-year observational study that I mentioned using testosterone pellets, have shown pretty good long-term safety in women. Because there's no FDA-approved product, there are basically 2 options for women to receive testosterone. Number 1 is to use a very small dose from a testosterone product that's approved for men. It's not an option that I really recommend strongly because it's pretty messy and it can be very imprecise. Number 2, you can work with a compounding pharmacy to get a female appropriate dose made just for you. Well, if you've watched all 3 videos in this playlist on estradiol, progesterone, and then this one on testosterone, first of all, thank you. You've taken the time to get yourself informed. You've taken a big step toward taking control of your own hormone health. If you still have questions and concerns, I've created a resource that can really help you go even deeper. It's called the Menopause Solution. It's my comprehensive digital course on hormone optimization. In about 2 hours, I'll walk you through everything you need to know about hormone replacement therapy for menopause. It'll help you understand your symptoms, evaluate your risks, and gain the confidence to have an intelligent, informed conversation with your doctor. In fact, going through this 2-hour course can literally mean that you've learned more about hormones and menopause than most doctors get in their entire medical school and residency training. And that's not really an exaggeration. It's about 2 hours that they get. This course is designed to help you make an informed, confident decision about hormones and menopause. Visit simplehormones.com/2 hours to learn more about the course and enroll. For a limited time, you can get a 30-minute hormone coaching call with me, the hormone pharmacist, when you enroll in the course at no additional charge. You've already done the hard work of asking the right questions. Now it's time to take the next step. I'd love to see you inside the course.